It is another edition of the Road to Recovery series with our friends from the Orthopedic and Spine Centers of Wisconsin. Alex Strouf, joined again by my friend Dr. Joe Sizensky from the Orthopedic and Spine Centers of Wisconsin. He is a foot and ankle surgery specialist, a board certified surgeon. And Joe, we have seen a ton of ankle injuries across football, and it seems like we do every year, but especially this year, I feel like they're coming in at a higher clip, whether that's a sprain or a break or just weird injuries, weird rolls that limit playing time. So I'll just have you start here, Dr. Sidzinski, the different severity levels of ankle injuries, because the ankle, I've rolled an ankle a time or two. It certainly doesn't feel good, and it swells up pretty bad when that'll happen. So walk us through the different severity levels of ankle injuries.
So ankle sprains are very, very common. Probably 10% of all NFL injuries are ankle sprains. There was a study over a 6-year period at the NFL Combine. More than 50% of every college athlete that showed up at the Combine had an ankle sprain in the past. So an ankle sprain is an injury to one of the ligaments supporting the ankle. The vast majority involve the ligaments on the outside part of the ankle, the lateral part of the ankle. Those represent about 85% of the injuries. So there are 3 ligaments on the outside part of the ankle. One of those ligaments is almost never involved, but there are 2 ligaments that are more commonly involved. So an ankle sprain is an injury to those ligaments. So in general, we kind of grade them as grade 1, 2, or 3. So a grade 1 is just a mild stretch of a ligament. Grade 2 is a partial tear of that ligament. And a grade 3 is a complete tear of that ligament. And you can have multiple ligaments involved, particularly on the outside part of the ankle. So, it kind of goes from mild, moderate, and severe. A grade 1 injury, you're probably back, in less than a week. But a grade 3 injury can take, several weeks to come back from.
Sorry about that, but I'm just curious, when you bring up the complete tear, is that always a surgical repair, or is there non-surgical options for that as well?
There are non-surgical options, and those can heal. The goal is to get it heal, but at the right length. So you don't want it to heal all stretched out. In that case, then you would have some instability that you might have to deal with. So the goal of treatment is to get the ligaments to heal, but also heal at the right length and recover so that you don't re-injure it or re-sprain it or develop chronic or long-lasting instability in the ankle.
And I cut you off before, Dr. Sidzinski, but when it comes to, obviously, level 3 severe, right? That's a complete tear. Level 1 can be quick. Level 2, I imagine there's a variation of return time when it comes to level 2. Is that the most common ankle injury you see, somewhere in between level 1 and level 3?
Those are probably the most common. In level 2, you're talking probably 2 or 3 weeks before you're kind of back at full strength. And then there's another kind of ankle injury that involves a different mechanism, more of what we call an external rotation injury, and those are the high ankle sprains. And those involve the ligaments that connect the 2 bones in the ankle, the tibia, which is the shin bone, and the fibula, the little bone on the outside. The ligaments that connect those 2 bones are called the syndesmotic ligaments. And a high ankle sprain is an injury to one of those ligaments. Those take much longer to heal and can keep you out for a much longer period of time. So those have a different mechanism of injury than the more standard, what we call low ankle sprain, which is the common ankle sprain that we see all the time.
So it's funny you say that, because when I hear high ankle sprain, sometimes I don't even think of the body. I think more so level of severity. So that's actually a different part of your ankle than maybe.
Right. Yeah. High ankle sprain is an injury to a different set of ligaments. If those ligaments are completely torn, in that case, that's a situation where you would need something done surgically. As opposed to the low ankle sprain, where you can generally rehab the vast majority of those, unless there's some other injury that's occurred in addition to the sprain that might demand surgery.
specifically when it comes to athletes, or high ankle sprains more common? I mean, I imagine than a regular, everyday, normal person. Is a high ankle sprain more common?
Right,
Commonly
because the yeah
happens
the
to athletics.
the mechanism of injury for a high ankle sprain is not something that the average person is going to be susceptible to.
Sure.
So professional athletes, because of the nature of their activity, are going to be more susceptible to the high ankle sprain, and there have been a number of those this year for sure.
Now, Dr. Sizensky, as I look on your page on orthospinecenters.com, I just see something you're certified in and have done before. It says ankle replacement surgery, right? I've heard of knee replacements. I've heard of hip replacements. I didn't know there was an ankle replacement surgery. What does that mean, and how common is that? I imagine that's likely in older
Yeah,
patients.
so ankle replacement surgery is done for end stage or bad arthritis in the ankle. Unlike the hip or knee, the vast majority of people with ankle arthritis have an injury, have had a history of an injury, as opposed to the standard wear or tear. But in general, it's similar in concept to the knee and hip replacement. You're resurfacing the bone and replacing the cartilage with metal and plastic components, and that allows for removal of the arthritic joint, so pain removal, but also motion and maintaining some stability of the ankle.
If you have a foot or ankle injury, there's one guy in the area to talk to, and that's board certified surgeon Dr. Joe Sizensky from the Orthopedic and Spine Centers of Wisconsin. You can find him online, and more information about him and the Orthopedic and Spine Centers of Wisconsin at orthospinecenters.com. I feel like I always learn so much talking to you, Dr. Sizensky. Appreciate the time as always, my friend.
No problem. My pleasure.